How can someone battling drug addiction take back control of their life and find help?
Our next viewer writes he's been battling drug addiction for a while and it's taken over his life. He wants to quit, but every time he tries, he ends up relapsing. The cravings are intense and it feels like the drugs are the only thing that numb his pain. He's losing his job, his friends, and his family's trust. He's desperate to get clean and turn his life around, but he doesn't know where to start or how to stay strong through the withdrawals. What steps can he take to finally overcome this addiction and rebuild his life? Dr. Geri-Lynn?
Yeah, so first of all, I just want to let this, person know that I empathize and I understand what you're going through because it's very, very hard to stop using or abusing drugs or alcohol. The second thing is if you are addicted to, a drug that's an opioid, for example, or something like a stimulant that where you have really gnarly or really, really significant cravings, reaching out to the medical community is a lot of help because there's something that's called medication assisted treatment that can help you with the physical withdrawal, the physical aspect of the addiction. And a great place to start is your primary care physician, and they can coordinate a referral for you. If you don't have a primary care physician, there's great federal websites that you can tap into. SAMHSA is one of them. And you could type in literally your zip code and where you are and what service you're looking for. And in turn, they'll provide you with additional resources that you can reach out to get the medication part settled. With addiction, what a lot of people don't understand is that there's a physical dependency where you go through terrible withdrawal and cravings depending on the drug, alcohol, etc. And then there's also the psychological aspect. And your brain gets hijacked when you use. And the part of your brain that's supposed to be making your decisions, which is your prefrontal cortex, is kind of quieted down while the limbic system, your animalistic, your pleasure, your reward center is kind of running the show. So that's why you find yourself engaging in really bad behaviors that you know are bad for you and you can't stop because you have this compulsion. So my recommendation would be if it were me or a family member or a patient, reach out for medication assisted treatment first to manage the physical part. Once your brain gets calm from the physical dependence and that medication helps you, then you can start to work on the psychology, talk therapy, talking with somebody like me, a psychologist, who can kind of walk you through or guide you through some of the other mental health concerns that often creep up with addiction, which can be depression, anxiety, etc. So definitely start with your primary care provider. You can also start with SAMHSA. You can look for inpatient facilities to do the physical detox inpatient and then convert over to rehab. And then you could also try to do it in an outpatient setting. But a great place to start is your primary care physician or your local crisis center.
That's some good advice.
Hmm.
Thank you so much, Dr. Geri-Lynn.